everyone, I'm Sophia, founder of The Princess Promise, and I am here with
Dr. Rob Frankel with Mainline Gastroenterology Associates.
Thank you so much for coming on our video.
Happy to be here.
So a lot of times when I tell people my condition or what I do with The Princess Promise, I hear a lot of, oh, I have IBS, or oh, my cousin has IBS, and it gets a little frustrating. So I was hoping that today we could inform the masses on the difference between IBS and IBD. So what is the difference?
Sure. Well, let me first start off by saying that, irritable bowel, IBS stands for Irritable Bowel Syndrome, and IBD stands for Inflammatory Bowel Disease. So, two different words, and there the B is the same, but the big difference is irritable versus inflammatory. But what's a little bit confusing is that people can have the same symptoms with both conditions. So it's important to distinguish, well, do you have inflammatory bowel disease or do you have irritable bowel syndrome? They are treated differently. Certainly they have, one has complications, the other one fortunately does not have much in the way of complications, but both can really affect quality of life.
Absolutely.
So it's important to, number one, identify what you really have, and number two, treat it accordingly.
And number two is the most important number for us IBDers.
There you go. So, so the main difference is that what that I letter is, so irritable or inflammatory. So inflammatory means if I take my colonoscope, or if I do a CAT scan, or some other form of assessment, stool testing, I will see markers, or I will see signs, or I will have visual evidence that there's actually inflammation in inflammatory bowel disease. And what does inflammation look like to me? Well, instead of a normal healthy looking colon or small intestine on the inside, it'll look inflamed. It'll, may bleed, it may have mucus, it may have some,
unpleasant symptoms.
Unpleasant, it will look unhealthy because it truly is an inflammatory condition. There are, and if you take biopsies, there are inflammatory cells which have made their way inappropriately into the wall of the intestine.
Very rude.
And
Very
are causing the symptoms. So that's what inflammatory bowel disease is. Irritable bowel is more of something that's, we take a biopsy, we look inside, we do CAT scans, do colonoscopies, everything looks 100% normal. But just because it looks normal doesn't mean that people don't have symptoms.
Absolutely.
And that can be actually very frustrating for patients with irritable bowel syndrome, because as of the present time, we don't have any physical diagnostic criteria, meaning no blood test, no colonoscopy, no CAT scan is going to show you anything that says you have irritable bowel. We unfortunately just go by, certain criteria. We call it the Rome criteria. I think we're up to Rome 4 now, which is, do you have alterations in your bowels? Does it cause pain, etc.? So there's criteria that we use, and if you say yes or no to enough symptoms, then we say you have irritable bowel. A lot of times that's really not satisfying to people because that doesn't really give you, evidence that you have it, but that's, what we unfortunately have to deal with at this point in time. I'm sure in 20 years there's going to be some test that says you have irritable bowel or you don't, and then a lot of people are going to be happier with that. But irritable bowel is probably something that happens more at the nerve level. So if I take a biopsy of the small intestine or the colon, things are going to still look completely normal to me, or look normal to the pathologist under the microscope. But probably what's happening is at the super microscopic level, with the nerves, there's either hyper-excitement or there's excitability or lack of excitability, and then that stimulates certain hormones and things that are beyond my ability to explain at this point, but things that can cause what's people say leaky gut, where your body is sensing things inappropriately and responding inappropriately to some of those things. And irritable bowel comes in a couple flavors. It comes in actually a few flavors: constipation predominant, diarrhea predominant, or you can have a mix of the two. And it can be very painful. In fact, I know this is an inflammatory bowel disease discussion, but irritable bowel affects more people. Affects about, the estimates are 10 to 15%, but it's probably more than that because it's probably underreported, especially by us guys. We don't like to talk about our bowels as much.
Neither do women, it's fine.
But second to the common cold is irritable bowel in workplace absenteeism.
Wow.
So irritable bowel is a huge problem in this country, and a lot of people miss work. And there's a lot of costs that go into that, whether it's seeking health care, missing work, getting certain testing that may not be necessary, like multiple colonoscopies, multiple CAT scans. So it's a big problem. So you will hear a lot of people unfortunately come up to you and say, oh, I have something like that too. They're different conditions. Fortunately, irritable bowel syndrome doesn't have, if you look at our previous segment where we talk about the difference between Crohn's and ulcerative colitis, it doesn't have the complications like strictures and fistulas, toxic megacolon. It's really just a quality of life thing. people live just as long with irritable bowel as any normal person would. Same actually with inflammatory bowel disease, even though it's like an inflammatory condition and you have to be on strong medication sometimes. People with Crohn's ulcerative colitis live just as long as people who don't have those too. But irritable bowel doesn't have any, unfortunately, irritable bowel doesn't have any active signs of inflammation, and it's hard to reach a target to treat,
Right.
Because it's really symptom driven. I guess the corollary to all this is that, does irritable bowel happen in people with inflammatory bowel disease? And the answer is yes. In fact, a lot more in the general population.
Interesting.
So even though it's 10 to 15%,
Double whammy. Love that.
Even though it's 10 to 15% of the general population, it's a little bit more in patients with inflammatory bowel disease. So irritable bowel, typically the symptoms is that either are, like I said, constipation predominant, diarrhea predominant, or mixed, meaning you sometimes have a lot of constipation, sometimes you have a lot of diarrhea. And the salient feature of irritable bowel is pain. And it's usually pain around bowel movement. So if you're somebody who has ulcerative colitis or Crohn's disease, and your doctor says, well, I just did a colonoscopy on you, you're in remission, everything looks normal, your biopsies are entirely normal, and you say, well, I still have symptoms, what the heck?
Yeah.
Well, they're not lying to you, that's what you had on the inside when they looked, and unless you flared in the very short period in between that, if you have symptoms and you don't have any inflammation, well, maybe you're an irritable bowel thing. And then your treatment is driven a little bit differently. So you stay on whatever's working for you, but maybe you need something like a fiber supplement. Some people will try probiotics, and then sometimes there's stronger medications for people who have really bad constipation, and I don't work for any of these companies, so I'm using brand names, but there's Amitiza, Trulance, and Linzest. Those are people with really bad constipation, and those actually have shown to help irritable bowel not just make you go to the bathroom more when you're constipated, but also actually affect the pain sensors on the colon, so you have less pain driven by that. And similarly with bad diarrhea, there's lots of medications, antispasmodics, there's fiber supplements, again probiotics, some various other things, rifaximin, which is an antibiotic, not like your typical antibiotics. It only affects the bacteria in the colon. There's Viberzi. I mean, there's a lot of medications out there for irritable bowel that aren't your typical inflammatory bowel medications.
So there is hope out there, no matter which one you have or if you have both. But always be sure to consult with your doctor before making any changes to your medication or your lifestyle. Thank you so much for coming on our video, Dr. Frankel.
Thank you for having me.